Good.
Okay, this is the Ogdensburg Bridge and Port Authority Childcare Initiative Committee meeting. It is Tuesday, March 14th at 4 p.m. We'll start with business items.
Can we do introductions here?
Oh, yes.
Just so everyone kind of knows it.
Short-term memory.
Go ahead,
okay,
Tony.
we'll go around. My name is Tony Kennedy. I am the chair of the Childcare Initiative Committee, and I'm also a board member.
Sam Burns, board chair.
Lynn Petrosky from the ARC Jefferson St. Lawrence, and Tara Carr is our Chief Operating Officer from the ARC Jefferson St. Lawrence. So she'll be joining us on the future endeavors.
James Chase, Director of Operations.
Great. Anthony Adamczyk, Director of Economic Development.
Steve Lawrence, Executive Director.
Patty Nisco, Chief Financial Officer.
Karen Blackburn, Senior Administrative Assistant.
Great. Okay. Okay, now business items.
Yeah, for number one, I've got a discussion with the ARC of Jefferson and St. Lawrence. We're glad to have Lynn and Tara here today, and I'll turn that over to Lynn right now.
Okay, so just, I think last time we talked maybe on the phone, I pulled up the renderings. We looked at just how you labeled the room based off square footage and then by infant, toddler, and then preschool age. So I know for one of the grants that you wanted to know possibly how many positions. I think, was that one for,
Yes.
okay.
We're sending in our third iteration of the CFA,
Oh,
and,
yeah.
and we found out that we need to nail a number of things, and one of those is job creation.
Okay, so I wanted to throw some different options out to you based off the square footage, based off those infants, toddlers, preschool age. It's not going to be definitive because it's all going to depend on the needs. But what I did was looked at 2 infant rooms based off these. I looked at 3 toddler rooms, again, based off these, and then 7 preschool age rooms, and the required ratio based off square footage. So if I go through and look at the infant rooms, you have 532 square feet per room, which that is 6 weeks to 18 months, okay? And I'm going to be forthright in that it's not a great moneymaker, but the staff ratio is 1 to every 4 children. So the max that you can have in each room is 8, giving you 2 rooms, which would be 16. Which would be equivalent of 4 staff. You move into the toddler room and it's 760 square feet per room, which would allow you 21.7 children. However, the max that you can do is 12 children per the regulation. So that's 1 staff to 5 children. With those 3 rooms, that would be 7 staff. And then if you looked at the preschool rooms, which you have 7 different preschool rooms, varying square footage, on average, you're looking at 17, 18 children per room. Usually it's 18 children, or you can do 21. We would really want to decide where we were going in the direction of the actual child care center. But if you just took 18 and did 1 staff per 7 children, that's 11 staff. Again, these are very high level staffing models, meaning these are perfect children coming in with no issues. That's, like a 40-hour work week. The only other thing that I thought about would be we would need someone to be like a program director or supervisor, and then you would need some admin support, doors, etc., paperwork, all that. There's lots of potential for growth, and I don't know if you want to highlight that, but so basically with those positions, I came up with 18, 22, 23, 24. And I remember when we spoke to Steve Hunt, he suggested we be modest, not be overly eager to really say like, oh, we could create 40 positions and then not be able to fulfill that. So that's very modest. Now, the other suggestions that I have is questions too. Is it 52 weeks? in Jefferson, and I'll reference Jefferson because we have a preschool down there, that follows the school calendar. So it's all the school breaks, they're off. 2 weeks at the beginning of summer and 2 weeks at the beginning or the end of summer. The holidays that the school has off. So it's 180 days in total. I think that you would need to decide, or we together, whether we wanted to operate 52 weeks out of the year. That would change what your hours of operation are, because you can increase capacity based off your hours of operation. So if we operate before care, after care, and then during the day, but our last student is picked up between 5 and 5:30. I'm not sure what the needs are specifically up here, because then you can either add more staff, add more childcare seats, if you will. And then do we want to look at branching out in partnering with different entities in the community, such as the Ogdensburg School District? In Jefferson County, we operate the Universal Pre-Kindergarten Program. We operate special education services, so it's an integrated model. And then we could explore partnering with Head Start, which then you attach some federal dollars to that. So lots of things to talk about, but those were kind of preliminary numbers to get me started. I do have some suggestions, and I am not an architect, but.
Well, that leads me to my question.
Okay.
When you saw that, that was kind of a base
Sure.
preliminary drawing based on the firm that we helped with that. They used that as a guide, and it wasn't specific
Sure.
at the time. Well, my question would be, what do you see in there we could optimize that would work in with your experience and things? I can build the building, but to put it to the right use of all of your programs and everything, that may not be what you're looking for.
So honestly, I don't have a lot of suggestions. My one thought was, and Tara and I talked a little bit about this, the infant room, we would have to explore. We don't do infant rooms in our current situation. There is a demand for it. I'd have to revisit that survey that we put out to see. Now, it likely has changed significantly, but you may want to even up the size of your preschool rooms to be consistent. And I'll tell you why, because for certification purposes, when the Office of Children and Family Services come in, if they can see that all rooms are 625, then we can definitely have, well, that wouldn't be, we might want to go 700. Then you can always have 18 kids. 21 kids is a lot of kids in a room. We have 18, which is about 50% special ed, 50% typically developing children. So my recommendation would be to shift that. I'm sure that's minor in an architect's world. In my world, I couldn't even begin to do it. It would just flatten out your numbers better. As far as having bathrooms in every room, that's amazing. Having, I guess a vestibule and then some admin support, amazing, because you're going to want a locked facility. We have locked facility and our parents can key fob in. It makes it very nice, and it makes it, I think parents feel more comfortable. Again, toddler rooms, it's 6 1/2 dozen the other. If you need them, we have one in ours. We probably, don't you think, Tara, we could fill another room of toddler? I feel like we have a wait list. And we currently have a wait list.
Tyler's what age?
So toddler is 18 months to 36 months. Sometimes at 30 months, you can move them based on their, what's the word I'm looking for?
Their developmental
Geez. Yeah, it's been a long day.
score.
Yeah, if they're developmentally ready to move to a, with 37-month-old children, then we can do that. It's forms we have to fill out. So I think we would want to know what you guys also see in infant, toddler. I don't think, Tara, they have 3, I know you know this, but 3 toddler rooms on here, which I think could easily be staffed and easily be filled, but that gives you only 36 slots. Where if they were preschool, at 7 rooms, you have 72 slots. So you can play with those numbers.
You did mention, is there room to grow in that building? Or you said kind of some looking toward the future a little bit, there's some flexibility in that.
So a couple things I noticed that I think are wonderful. So the multi-purpose room, I don't know what you have envisioned for that, but that to me would be a room like gross motor. We have 2 in our preschool, and the kids use it all the time because they might not be able to go outdoors and you need to get them running
Right.
around.
Right, we kind of balance that with the outdoor
Yes,
thing
yeah.
because of other things.
Oh, absolutely.
Yeah.
And it's great. And then I also saw that you had a therapy room / maybe library. I think what we're doing in Canton right now is in one of our buildings, we are starting to provide some what we refer to as related services to children. So it's if a child needs to be evaluated to determine if they need additional supports, we're doing that. You wouldn't need an entire room necessarily. You may want a bigger room because we have like our clinical staff, we have OT, PT, speech that come in and do an assessment. Right now, a lot of St. Lawrence County families are driving to Jefferson County. It would be much easier to say, hey, can you come over to Ogdensburg? Even if they're not from Ogdensburg, if that's okay
Yes.
with you guys. I'm just assuming. Tara, do you see anything else on there? I don't want to monopolize the conversation, but.
No, I would just make mention of the rise in autism services and the lack of them in the North Country. And that's another service that we're looking at expanding on, is being able to provide that therapy for autism.
So great point, Tara. Thank you. So that particular, we had at one point, we had, I think 42 children on our waiting list. 36 had a diagnosis of autism or were waiting an evaluation. So we are working with a consultant right now out of Boston to help us lay the groundwork for how do you get that up and going, right? We all have our plates full. To figure out the billing for private insurance and all that is just not in my wheelhouse. So we are working on that. So that could be another potential where, you have an evaluation room.
I guess just as a general statement, when we finally get to getting drawings done and things, we'll need your very important input on that. And I don't want to speak for everybody, but I'm kind of deferring to you only because of my lack of knowledge of the actual regulations and the programs there. So, when that drawing is kind of everything that I've picked up, just general knowledge.
You
And
did
so-
good.
Okay, but it was asked about, indoor versus outdoor play, and then, and I believe some of the reasoning that you've given to us was told to me that, so that's the reason some of that's in there, but by any means, that isn't, that's not, of the final or anything like that. And I know Tony has some, she's a little more involved in some of the the questioning of programs and things.
Sure.
That you probably have some questions for her there.
Yes, so
Ask
regarding
away.
autism, are there any other organizations in either county that deal specifically with autism?
No.
No, so this would be a unique.
Very unique.
Service.
So we do have board certified behavior analysts, right, Tara, BCBAs?
Well, yeah, in the billable term, that would be a licensed behavior analyst. That's where we get the money from. So most of ours qualify for that as well. They're licensed.
So we have, I think 5, Tara, licensed, and we're home growing a few more. So that's why we're using a consultant to help us, because there's 2 locations in Jefferson County that provide ABA therapy, which specializes for children with autism. And in order for us to provide that, and we push into all the schools, 8 schools, 7 schools in St. Lawrence County. But we have to be able to fund all this, so that's why we're looking at how we can bill people's private insurance. But it is also now being covered under some Medicaid.
Okay.
So, but no, nobody does it. And I just said today to our clinical person that if we don't do it, somebody's gonna, right? And
Lynn,
yes,
I'd also make mention that because this ABA therapy, there's a strong need for it. You know, there's more and more insurances, including Medicaid, that's starting to cover this type of therapy.
Mm-hmm.
And there's a lack there of it. So there are more crisis situations occurring across the state, and there are less providers being able to handle the crisis situation. So there's a lot of money being thrown at crisis intervention right now for these types of services that could be available if you were developing some sort of space to be able to provide that therapy.
Mm-hmm.
My other question is, with these services growing in need, do you envision that the staff is always going to be shared between the counties, or do you see this as an opportunity for there to be full-time specialist jobs created here?
So I wouldn't say they'd be shared. So for example, Tara and I, administratively, we would be shared. But as far as the staff assigned to Ogdensburg, just say it's Ogdensburg Port Authority Child Care Center, those staff are hired for this center. It's no different than in Jefferson County. The staff are hired for our preschool. If they choose to pick up hours after, you know, the daycare operation, that's their prerogative, but they're assigned to St. Lawrence County and they're assigned to here. This is their home base. So it would just be like for clinical staff, if we ever did anything like that, that would be a shared, right? There are employees, but we can't, it'd be very cost prohibitive to put a PT, OT, and speech therapist here unless the need supported it. But again, as it pertains to grant writing, you could say we are going to create a quarter of a PT.
So along that line, Anthony had a question.
Sure.
Go ahead.
Yeah, so the ABA therapy, right?
Mhm.
Now, we have a very compelling case here because there's no services available.
Mhm.
Do you think that's good to build into our application or funding
Yes.
applications? Do you think that's something we could
Yes.
actually, okay.
And we can
So
probably
speak away.
dig up a lot of data, right?
Okay.
So we can dig it up from Jefferson County and our experience there. We could have our team in St. Lawrence County, like Chris. I'm sure Chris has a lot of data. Don't you think, Tara? Or
Yeah.
Jen? Because we're in the school districts now. I'm only speaking from the experience that I have had over the past several years with autism. And I got a call this morning from a parent wanting their child evaluated for autism. We can't do that. We don't have that. We don't have that ability right now. I also had a gentleman who wrote a book called me this afternoon, and he has a panel and he wants us to get the information out, and he's a St. Lawrence resident. So, you know, it's just all around us. So it would be very compelling.
Okay.
You would probably have to incorporate it into something within this building.
So just, I'm sorry, go ahead.
No.
So I guess what I'm afraid of, I don't want to
Overcommit?
or overpromise something. So that's the reason for the question was, those things that you feel that are specific that really would help the application would be important at this point.
Are you asking me a question if I think
Yeah.
we should include autism services
Yes.
out of this center? I would say yes.
Okay.
I wouldn't overcommit,
Right.
meaning it's not going to be a center, right? We're not going to build an entire center that only serves. But can we provide ABA therapy out of this site? Yes, at a limited capacity. Let's be honest. You're going to get.
Yes.
You're likely the minute that is out there, and Tara, anytime, again, jump in and cut me off. If at any time it's out there that we provide autism services, you're going to get inundated.
Yeah.
Wouldn't you agree?
You're gonna get inundated with any type of related services. Right now, there is a waiting list that nobody can even get to right now for OTPT, speech, and ABA therapy. So
Mhm.
if you can incorporate any of that, you've got a strong platform for sure.
And one of the other things that, again, I'm not trying to get into your grant writing because I don't enjoy it. But you have colleges up here that have degrees, you know, PT, OT at Clarkson, SUNY Canton does a ton. So I mean, even to piggyback off the fact that you have a resource right in your backyard of where you can get future employees. So if as Tara's saying, the demand is ridiculous, at least you know how you're going to tackle that demand, or we are going to tackle it.
Sure. Go ahead, Tony. I'm
Sam, do
sorry.
you have questions?
Oh, you're doing good.
Well, I know in the letter of intent, which I want to thank you for, because I
Oh, you're
think that definitely strengthens our application, and I think it makes the connection between childcare and OBPA, which is really important.
Mhm.
In the letter, there was a mention of home
Health home.
home health case management. Can you describe that?
Sure.
And if that would be something that could go in here?
So we actually have it up here already. I hired our third case manager, I think back in January, and she's stationed out of St. Lawrence County because we cover the Tri-County area for that. It is Jefferson, Lewis, and St. Lawrence. We started it in Jefferson County because we were seeing a gap in service, right? So if a child was on a waiting list, they sat there on the waiting list and there was nothing we could do. So at least if they have some type of diagnosis, it could be diabetes, it could be ADHD. The list is almost ridiculously long, and you have to qualify or be enrolled in Medicaid, which most of our families are. And it was a way to keep the families engaged. It has nothing to do with any type of IDD. It's strictly a Medicaid and some type of chronic diagnosis. And we focus on early intervention age or preschool age because we didn't want to step on other people's toes, because it's a DOH program, and we're primarily OPWDD, OCFS, and SED. So it was kind of our first entry into managed care, and it was a way for us to start getting involved with people outside of the IDD population, because we know we can do good things with it. And we will probably add another case manager, I would say within 2 months, a fourth one.
Okay.
So if the need is up here, we will do it. Additionally, we are going to be researching over the next several months an early childhood case manager, which we have one in Jefferson County and adding a second one there, which supports special education children that parents need that conduit. So there'll be 2 different layers of case management.
Okay. I guess my other question is if the childcare staff would be MAT certified, would they be able to give medications?
So we don't do that in Jefferson County, and the only reason we don't is we have a luxury there. So in our adult population, we have a whole team of RNs, and we have an LPN on staff in our preschool. So we haven't needed our staff to become MAT certified, but I would highly recommend that we do it this time around. And it would probably begin in the planning phases, right? Because you have to do some med passing, you have to go through a training, but it's definitely doable.
Excuse me, does any of that affect the design of the building?
No.
Like
No.
there's nothing that's
You,
maybe locked or cabinetry and stuff?
so you could, I don't think OCFS, so OCFS doesn't require like a double locked, but you would have that anyway.
Yeah.
So if you turned, just say a therapy room and put a locked cabinet on the wall. We have children that, Tara, doesn't the one young girl receive her meds through, is it her feeding tube?
Yep, we have some in it, yeah, through the G2.
So,
feeding tube.
and then we do have a little boy that they're monitoring him for diabetes, so we do prick. And, but again, we have the
I was
luxury of the
gonna say,
RN.
that's because you have healthcare staff. How would that look here if we had?
We would have to have people either, our agency would have to commit to having an LPN on staff to pass the medication, which I will say this to you, it's not a huge added expense.
Oh, no, it's okay.
It's not. Now, I think the competition would be grueling because of, you have St. Lawrence Psychiatric, that's still here, right?
Yep.
Yes,
Right. So for us to hire an LPN, that's a competition for us to hire RNs and LPNs in St. Lawrence County. But the MATs could do that.
Okay.
And one luxury we would have if we did the mats. There is a portion that an RN has to either do the training. Tara, I can't remember specifically if they have to do the training or observe the passes.
Yep, they have to do part of the training and they have to do a certain number of observations. But again, we could have RN and that'd be a shared person. If somebody has to be certified, go to St. Lawrence County and complete that for that. So
Right. So that's a luxury that we have of the RNs, and our director of nursing out of Jefferson County is very well versed in the childcare world just from it being in the same building and us calling on her when our LPN was out. So she loves that. We do have a nurses station in our preschool.
Lynn, there is a sick day, it looks like, on their drawing, so they are prepared for it.
Okay. Way to go, Steve. No, I don't see it, Tara.
It's down by that vestibule. But I would, for whoever designed it, I would extend the opportunity out to you to come to our facility at 420, and it may actually trigger some more ideas.
Good
We would,
suggestion.
yeah, we would welcome that because there's lots of things we would do now that we should have done back. So for example, when we had SUNY Canton down, they asked why we didn't have the two-way mirror in one of our therapy rooms. And I was like, oh my gosh, like, I don't know, when people are doing evaluations and we're observing a child. So there's lots of things, not lots, that's not true. There's a few things. You know, more, you spoke to the health home case manager. You know, there may need to be additional space for that type of support. And I know you have one office here, but do we need more? We've jammed a few people in kind of a little multi-purpose office space and they don't like it. They're trying to have confidential phone calls with families and school districts and they don't like it.
You can't overlook that. I mean, how important is.
Yeah, hindsight is always 20/20.
So I guess that will lead us to our next, well, I think I've asked most of my questions.
Okay.
Does anyone else have any questions? While we have Lynn here. Hey,
I did want to know I have a question about, so are you ever going to look to do, and you're probably going to say it's up to us, but I would like to know what the needs are, the wishes are. After school programming for students, like say someone brings their child here and it's a 3-year-old, but their student or their son goes over to Ogdensburg and they want to pick them both up here. So would you do after school programming?
I
thought that was discussed. I don't think a decision was made.
Okay, and the reason I bring that up is because again, I would consult with our OCFS leads in Jefferson County because there's certain things. So the room specs, like the little toilets and the sinks, and there's certain things that would be designed for little kids. Now, can you run the after school program in the multi-purpose room? If not, again, you may want to look at giving up one of those toddler rooms, logistic numbers that we would have to really probably redo some type of needs assessment.
I would think just to look at as we go forward, those things that we feel are nice to have. I don't want one of them, you know, what is it? I don't want, I want to have, well, I guess, want to have something that does the greatest good. And I don't want to, if something we put out there, and you would know this, whether it's a financial burden or that, you know, can put in jeopardy some of what we're trying to do, we just have to go back and forth on that. So a lot of these things all sound great, but I don't want to say that, you know, we have to have that so that it may take away from the core of what we're trying to do, if that makes sense.
Yes, and the only reason I bring that up, in Jefferson County, the YMCA does all the after school.
So that takes care of that.
Right, we never have to worry about it. I think during COVID, OCFS approached us to possibly do like an area.
Does the Boys and Girls Club do that?
That's what I was gonna ask. Does YMCA come and pick the kids up?
No, so what happens is they push into the schools. So after school, they go in and they have like team leaders and they do activities with the kids.
YMCA personnel go
At
to
the
the schools.
Mhm.
It's called the STAG program.
So your kids go to the center, to the school.
Not our kids, no. I was just saying in general. Our kids are picked up some by parents. They stay, we're open till 5:30. Parents pick them up at 5:30. The special education students are bused in, whether it be Jefferson, St. Lawrence,
Right.
Lewis County, and they're picked up on the bus, by the bus at 2:20.
I'm just thinking now, I believe, some of the kids from the school is bused to the Boys and Girls Club.
So it'd be similar, but are you saying some of the YMCA people go to the Watertown schools? for
They're
that
actually
stuff?
in the Watertown school, so
They're already
the
there.
staff
Oh.
push into the school district after, if parents need after-school care. And then the parents just pick the child up. There's no busing or anything like that. But again, geography is different in Watertown.
Yeah, it could be that the school buses the children to the center for a center staff to receive them and bring them in for the rest of the day.
And that's good if you've got two different age children, that they can be in one spot.
Yeah, I don't know what families, again, we'd have to revisit. There was data that was,
Yes.
right, so I would
it
just have
was.
to look
Yeah,
back
I'm wondering,
in.
it's been a little bit. I
It's
don't
been a
know.
few years,
We
right?
should maybe
Yeah,
keep that.
Add 3 years to every
I know,
kid,
I know.
every age bracket, right?
So we had a general idea of what was in need a few years ago.
Yep.
But like you said, it could change.
We had in our conversation, we had a discussion over your building out like the equipment and things for the, and you said that you can, that would be something you could pursue.
Yes,
That we could take, because I did, in our budget, we've got, I want to say 400,000 to 500,000 in build out in our budget to take care of, just those things we've seen with what we've toured, and it was just throwing a number at it. But it would be, and as you said, if you could put out go for a grant for that, is that?
yes.
That's definitely doable.
So I talked to Michelle Carpenter, she's our foundation director. And she has successfully submitted grants. We did just get one in St. Lawrence County on 9 Commerce for some equipment for the children's program over there. I'm gonna get with her the cost. Tara thinks I was very low, and she's probably right. When I was talking to her yesterday about it, I'm like, we can get a grant for like 20,000 to get equipment. She's like, I think it's gonna be a little more than that. So I'll get with Michelle Carpenter, who writes the grants, and see what we spent on all of the equipment in classrooms in our new building. Now, she was very high end, right, Tara? Like the equipment cost.
Oh,
She hung up on me. She didn't like my answer. I'm pretty sure we were pretty high end. I'm not saying that's necessary. She'll probably call me back. But I can get a cost of. Can you hear me? That's okay. Did you hear me say, as far as the cost of the school equipment at 420, don't you think Michelle probably went very high end?
Yes, 100%.
And I'm not even saying that we need it, but like there's certain specs with, you have to have lockers, you have to have little cubbies, and each child needs their own cubby. Like OCFS doesn't allow you to share, so they're micromanagers.
And mostly it would talk to those things that, I don't want to say they're consumables, but over the years, if something, it needs to be replaced, if we know that, that was your purchase, we can work out how we do that then, but the idea would be, there's going to be some things that might cross to where we put that in, it's fastened to a wall and it's going to stay there for years to come, but we can work that out, but
Absolutely.
I did put in something there for, mats and just all those kind of things that just as a general number to cover that. So if someone asked me, I'd just say it's in there, but
right.
it may be, might be awful large, or it could be just right or not enough. So.
And again, I'll get the costs from Michelle, but I wrote down universal pre-kindergarten, and I know it's offered in St. Lawrence County, but there's a great example. If you ever were to pick up, just say 10 slots of children from a universal pre-kindergarten program, there's grant funding that accompanies those children, right? So you're required to buy supplies that align with a curriculum that are for the classroom. So some of our supplies have all come through that. OCFS has had several grants. And as you get closer to having a structure, then there may be some more opportunities, but there's foundations and people love to give things for children. They truly do. Those are easier grants to write than I think for residential housing for people with developmental and intellectual disabilities. There's no money there. So.
I have asked questions.
They were all good ones and easy.
So we've kind of been already reviewing the current building renderings design. Is there anything else that you wanted to add to that?
I don't have anything there in item 1 there.
Are we still looking at 15,000?
Excuse me?
15,000 square feet, is that,
Yeah, it's, I think it's
That's-
17.5 maybe. Oh,
what is it?
I think it's 17.5.
I was also, and I didn't do it. I was gonna get you the exact square footage of ours is 2 stories. I like 1 story, but I was gonna get you the exact square footage and I don't think I ever did. So I will.
Do you think we're smaller than the 2-story?
No, I think you're larger.
Okay.
Because you have 12 rooms, we have 7.
In each,
No,
Sorry.
total,
Oh,
7 in
7.
total. But again, we have therapy rooms, we have a nurse's station, we have sensory rooms for special needs students. So I'm sure we're right about, Tara, do you have any guess on that one or no?
No, but while you're talking, I could look at our floor plan to see if I can figure it out.
All right, if not, we can get it to them tomorrow.
Yeah, I don't want to underbuild.
correct.
But again, as Tara mentioned, if you guys want to take a road trip and come down and, visit the building and think of things, we have a tunnel that the buses or parents drop the children off. There's no, exposure to weather. We did have a major leak, or a pipe blew, right, Tara? Is that what it was?
Yeah, yep.
Yeah, so. And we could probably share do's and don'ts.
Yeah.
We would have Michelle part of that conversation.
Well, yeah, when we get to the real meat of
Mhm.
all of that, you'll be in the room with us because that's where we're gonna make the right decisions,
Mhm.
But I think overall, I think that's enough right there to give you a good feeling of, what we're trying to accomplish.
Sure, yeah.
Okay.
Absolutely. I just, random thoughts is the way the doors lock and the handles move. I think after we had some doors that had locks on it, and they're like, you can't have that. I'm like, oh my God, we have to switch all these handles out. But.
Well, we'll benefit from your experience.
And we'll lean on OCFS, the regulators that come through and do your inspection before. They have the fire prevention that comes in. There's all sorts of things.
Will they be part of the final design approval?
So when we did our new building, the architects were well-versed in school buildings, childcare facilities. They know it better than probably
Right.
me. But we have to upload things and apply for an application, and you have to have fire exit strategies. You have to have a evacuation plan and then an evacuation location. So yes,
So all of those drawings really fit into your, what I would say, your program and your application when you're going to do that for that building.
Yes,
So they'll get to see everything in that. And
yes. And where is the building location?
It's in the middle of the park, if you're
Well, I
looking
use-
that way. Oh,
Yeah.
yes, thanks, Chief.
Oh, I was like, that's the highway, Steve. They'll never approve us. Oh, okay.
So
You can't see it, Tara. Just look
there's
at-
our building right there.
Yeah,
So, you'd come out and you could go in either way, you could go there, but there's a major utility corridor through here.
okay.
And then So that lends us to reducing the costs. So there, and then this building or this property has been looked at a couple of times for, you gotta have runoff, parking lots and drainage and things like that. So we know that it's the right size. So that would be the area. And then this roadway would you could come in and a loop will by that. So, and then it gives us all kinds of room in the back that otherwise we really can't shoehorn anything else in there. So we kind of dedicate that whole space right there. But if you were looking here, you look behind those two buildings and it would be
Okay.
all there. It's not green now, it's all white.
No, yeah, yeah. I'm getting the gist of it.
So what kind of relationship do you have with OCFS?
So ironically, I worked at the Children's Home in Jefferson County for 11 years. So my licensor there became my licensor at the ARC Jefferson St. Lawrence. She's now a supervisor. So I think we have a very good relationship. Now, I'm not sure if they cover St. Lawrence. I can ask her. I have that kind of relationship with her. But her supervisor who oversees, I'm assuming, all of the region, was our licensor as well. So
Can you get us a name?
yeah, for sure. Yep. And I actually talked to Ann about, well, that was our licensor. And I talked to her about it because I was concerned about the body of water, right? And if that were any type of obstacle, no, you just have to justify how you're going to keep kids safe.
Shall we move on to 2, update on the
Yeah,
CFA grant?
just quickly, everything you see in red on that, does everybody have anyone have a copy of that?
I do.
Tara probably can follow along at home.
Tara does have it in her email.
Okay.
Yeah.
You see the childcare planning, that's our March 2023 update. Project feasibility, everything kind of in blue or check marks. We've addressed, and it's kind of like Tony knows this, that I like the planning part of things, and I like to have this in front of me. So we're not rehashing stuff going forward. But in phase 1, it's pretty well complete. Phase 2 is the same way, but you'll see we're still continuing outreach with all kinds of government entities. And that was one of the reasons for Sam's question. We want to reach out to the state. What is that department called?
Office of Children and Family Services.
That's the same one, right?
Yep.
Yeah. So
Because no matter what state entity we deal with, they ultimately govern the building, right? Their regulations supersede anybody else's.
And then you see at the bottom, February 2023, the ARC of Jefferson and St. Lawrence provided an updated letter of intent with the OBPA as a potential operator of the childcare facility. The ARC of Jefferson County is also providing an integrated preschool program report for St. Lawrence County. You sent that along to me, and I forwarded that to committee members.
That was the one Amy did, Tara.
Yeah.
I was just making sure Tara knew.
And then you see on financing, it's ongoing. We do have a commitment of 2.1 through our congressional leadership, Senator Gillibrand, Senator Schumer, and Representative Stefanik. And we're very thankful for that. That really is going to help our CFA award. So when you see funding sources, you'll see there that we are requesting a similar amount for 2023. This is our third iteration. We have reviewed our draft application with ESD personally and gone through it kind of page by page to strengthen our submission. And that came from what you and I talked about also. We went down and talked to Steve Hunt also.
Oh, good.
With that, and Steve reiterated, it wasn't a very long meeting because he had some, but he reiterated a lot of what we talked about on the phone
Okay.
with that. So don't overpromise, but also that's why we're asking. There's some things I can see here that we can add. So we anticipate submitting that. We'll see, but I just put April 1st right there because I think Leanne was kind of anxious to get that out. So And let's see. Phase 3, just I updated all of those. Those are pretty much where we had them last month. Nothing's changed there, but I've left kind of rough numbers, but they'll all depend on the financing. Do you see anything with that timeline that, you can see where some of that's actually gone out 2 years already?
Yeah, yeah. So I think we just have to be careful with our numbers and research that we put in as far as data, because if you're now looking at another year and a half, right, that data is going to be old.
And can that change the main functionality of the
No, I think
building?
I think you're probably always going to have kids that fit into what you currently have. We're living proof of it, right? We built to have a little bit bigger preschool, and we're still busting at the seams. And I think no matter what, you'll have those kids.
Nobody ever said, I wish I built smaller.
We wish
Never.
we had added more.
Yeah. So we'll try to, and we'll be relooking at our budget here with it known that, maybe you can help out with equipment. And then also we found out that, and I think I put in as part of that, our donation of the property. We put a number in there that will basically say you can't use that for the budget. Which is fine. We don't have to go out and buy it and all of that. So that may knock our budget down to a more reasonable level. I mean, we know the numbers, but it does help out. That sound right, Anthony?
Yeah.
Okay.
Yeah.
Mr. Chairwoman, that's all I have for the review.
Okay.
And the update on the CFA grants. I mentioned all of that.
Does anyone else have anything for Lynn? How we have you?
I just wanted to say that I was hoping when we started this, that it would be functioning now.
Build the building, we'll get it functioning.
Had nothing to do with anything you.
I know.
It's funding and everything else that, I mean, we understand there's a need, a very large need. And it's just, you get frustrated after a while when all these roadblocks come up in front of you, knowing that the need is so great and how it should, everybody should step in line and get it done. And it hasn't happened yet.
And I'll just share with you, and I think I've shared with Steve before, we pretty much funded our entire renovation. The grant opportunities weren't there. There was not a lot of buy-in. People use that as a platform that should be edited. As childcare initiatives and whatnot. Unfortunately, we were shovel ready. We completed the project and we funded it in its entirety.
You have no regrets about the timing of all of that?
No, actually, I find that COVID was a silver lining because we didn't have to do the building in phases. We wiped it out completely. Went in, the kids weren't in school. We ended up having an opportunity to lease an old school for a short period of time. OCFS came in, certified us, because it was a year after the schools were closed. So it worked out to our benefit. But again, we did it solely on our own.
Did it hurt you at all financially?
No.
You had planned well enough in advance funding wise?
Yes. And I think, there's certain benefits to COVID. I think, we maximized billing in other programs and, really looked at different things. We did have donors, don't get me wrong, but a bulk of the $13 million renovation was funded solely by the Arc Jefferson St.
I have a question that I don't know if I ever asked you. Would a lot of the backroom things like payroll, insurance and things for employees and stuff, that would be shared probably, or will you have something set?
It's shared as in
like your organization, did they just go into the system and you don't need an accountant or all of that? So
it's to us,
you're maximizing
yes,
and getting money in return through here, but lowering your costs.
So to us, this is, and I don't mean the word just, but it's just another program. right? If you think about it that way, it'd be like us opening another house or another day program.
No, and I'm just thinking in terms of we know the emphasis and all we've been hearing is how much it costs parents, and you know this better than I do, but I'm just saying, we want to do everything we can to keep that liability down so that, we can make it affordable. I mean,
Right.
That's the big thing about childcare, but we want to be able to do our best to keep that, to help you to keep that low.
Right. And I mean, where your biggest expense is going to be your staffing. So, I mean, there's a lot of subsidies out there. We have a few families, because half of our population is special education, the school pays the tuition. But we also have people who receive DSS support, and they just supplement their own. There's different, OCFS gave out grants for childcare during or soon after COVID. So we always try to keep within market. We don't go really above market at all. It's not a money maker. If you break even and serve your mission, that's about what you're going to get out of it.
That's what we
Well,
do.
that's kind of how we want to look at.
Yeah, it's
what
not.
we bring to it, that we can be able to take care of the building in the future and take care of it now.
Yep.
And
not get rich.
And not get rich, but it's not, but it serves what, the whole purpose of that. So we're with you on that.
Yep, absolutely.
Hasn't the support on the state and federal level for childcare somewhat changed so that it's more positive and supportive?
So I would say that there's more discussion about getting people back to work and affordable childcare. I don't necessarily, we've seen some positives from that. OCFS has provided grants, stabilization grants. But we haven't requested funding for any of that.
Okay.
Because we've pretty much, we're settled unless we do any type of expansion. But right now we're being approached to do partnerships, which is perfect for us.
Okay. I'm finding out.
Tara, do you have anything you want to add or say?
No.
Okay,
All right.
great.
Well, thank you, everybody. We appreciate your time and look
you.
forward.
Thank
We'll
you.
get some information to you tomorrow or the day after, and we'll go from there. Bye,
Good.
Tara.
All right, thank you.
Sarah.
Thank you so much.
Thank you.
You will also like Tara. She's a go-getter. She will make sure things get done. She was probably taking notes, and we'll have a list for me tomorrow to make sure I get to you guys.
Thank you. It was.
Thank you, guys. It was
very
great to
helpful.
see you. I'm very excited, as always, to work with you guys on this project. And I'll go
Drive
out-
safe.
Yes, I'll go out the right door.
Okay. Thank you, Miller. Thank you.
Okay, do we want to set a next meeting right now? I know you said like we're planning to submit the grant early April. Is there a need for an update following that?
I don't think, I won't have a whole lot to bring unless something goes on, I think Lynn's really brought us up to speed on what we need to know. So the one thing I do like the momentum of it, Tony, that, if you can do it every 4 weeks or 6 weeks, just, but I don't know until we talk to Leanne on
Yes,
when
new
that
developments,
application.
I think that's gonna be,
Yeah.
there'll be a slight lull.
Yeah. So what's your feeling?
I like the idea of meeting regularly, just to touch base, maybe not monthly. Maybe we could schedule another meeting for May, just to kind of keep everybody in touch.
Sure, and if we need
Hopefully
something
Nicole
earlier,
can
we can
attend
do
next,
that.
next,
Yeah.
next meeting. So, I don't know how everyone feels about that, but
So
May's a good timetable.
go ahead, pick a date.
May's my birthday month.
You get a
Very
birthday
special.
month?
Yes.
I only get a
Very
birthday.
Oh, goodness.
That's it, yeah.
No, it's not.
Shouldn't be. It'll be the heart of the playoffs. You just,
What's everyone thinking?
you put a date.
I imagine it'll probably only be a half hour, so you can either piggyback on something or just pick something for middle of May. That's fine.
Are there any other meetings already scheduled for May?
No, not now.
No,
No,
yet.
not yet.
Yeah, with everybody's schedule, it's just so
There
hard
will
to
be.
throw that out there.
Well, finance
Personnel,
usually goes right
finance.
Finance is probably the most routine one.
Well, that one usually doesn't happen in May because of where
Oh, that's
Memorial
right.
Day falls.
So do you want,
Oh, yeah, when is Memorial Day?
I don't
The
know.
last Monday in May, 29th.
29th?
Yep.
Okay, so we want to steer clear of that.
so what would you do if you did bring a finance, would you do it the Monday before?
No, usually it happens in June.
Yeah, first Monday in June.
Well, I know Nicole can't do Mondays because of county meetings.
Okay,
Oh, yeah.
So we should steer clear of Mondays. Tuesday are town board meetings. And Thursdays are usually our meetings.
so Wednesday, the 31st.
Wednesday, the 31st. That works for me at this point. We can schedule it and then
We can,
just so it's
we can
on the
move it.
books and have it.
so let's just say the 31st.
Should we push it out to 5? So
You
Nicole
tell
has
us.
time after school to
Whatever
get
you
here.
want.
Yeah, you'll
Yes,
move
okay, let's do May 31st at 5,
it. Okay,
tentatively.
that's good. At least we get some on the books.
Yeah.
You guys okay?
And then we can reach out to Nicole too after and get a feel for what she's
Should be able to.
thinking. I don't think that's any school breaks. I think,
No.
the kids will go back to the 30th. Okay. Steve, are there any other such matters?
No.
5 o'clock, you said, right?
5, yes. Okay, so if there's
Okay.
nothing else, I guess I'll take a motion to.
Make a motion to adjourn.
I guess I'll second it.
That's all I got.
Okay, all in favor?
Aye.
Aye. Okay, meeting's adjourned at 4:56.
Thank you.
Thank you.